From pro athletes to high school players, even weekend warriors, dealing with a sports injury can be tough, but the team at the Jacksonville Orthopedic Institute can help you get right back in the game. Dr. Kevin Kaplan is an orthopedic surgeon and sports medicine specialist. Thanks so much for being here.
It's good to be back. It's been about a year. So.
I know. Good to see you. And I know you were at the Jags game yesterday, so you're going to fill us in on all the kind of sideline stuff. But first, we want to talk about you and your practice as an orthopedic surgeon and sports medicine itself. It's really become quite the specialty.
It has. You know, I've been back in Jacksonville for about 7 years now and joined JOI. We have 31 physicians, which it's a big group and it's a great group. We have specialties, specialty surgeons in all areas. And I chose sports medicine. I work mostly on the shoulder, the elbow, the hip, and the knee. And I see patients, children and adults, and pretty much treat the sports-related injuries, weekend warrior type injuries.
So let's talk a little bit about what it's like to be the head physician for the Jacksonville Jaguars and the orthopedic surgeon. You're right there on the sidelines, just in case anybody goes down. You take them right back there, see what's going on, try to fix them up. What kind of challenge is that?
It's like having a second job, really, and you know, different than you or I. If I tear my ACL, you know, fortunately I can still go to work, I can do my job, you could still do your job. These guys, when they hurt themselves, when they have ACL injuries, shoulder injuries, that's their way of making a living. So it's trying to get them back onto the field as quickly and safely as possible. And unfortunately with the NFL these days, there's not a lot of completely healthy games. We have injuries. If you look across the board, all the teams are dealing with injuries, especially as you get towards the middle part of the season. So it's a real challenge. I've enjoyed every minute of it. I was an assistant for 4 years, and now I've been the head doctor for 3 years. And so I really enjoy the group of guys. I enjoy the camaraderie, and it's a challenge every day.
Oh, you mentioned ACL. I remember back in the day when Mark Brunell went down with an ACL. ACL became like a household term. Everybody understood exactly what it was like to have an ACL reconstruction and the surgery. Let's talk about the road to recovery since we're talking about the Jaguars for Derek Marks. Tell us a little bit about he was able to play yesterday on the road to recovery. That's all good news.
Yeah, so we did his surgery. I did his surgery actually in January at the end of the last season, and you know, ACL reconstruction is both a mental and a physical challenge on these guys. You know, the physical part of it is actually reconstructing the ACL, but the mental aspect of getting back into the game is a whole different ball game. So, you know, he's been back for 3 games. He looks great, and his knee's stable, and it's a big challenge for these guys in trying to get back to their old form. So
yeah, some would argue that after Mark Brunell hurt himself, he was never quite had the same confidence level because I think he was so conscious about getting hit again.
Yeah, it's a tough injury. I mean, you see, you know, again in the NFL this year alone, you've seen so many ACL reconstructions, and so I think as we continue to go on, we're seeing the numbers go up tremendously. So
it's so interesting that you bring that up because it did. It really became such a pivotal part for the Jaguars' history. So let's transfer a little bit from the Jaguars, because obviously that's the big show, to some of the injuries that you see with some of the younger athletes that we have, because you know there's such a focus on concussions, but really before you even get to a concussion, there's so many other sports where kids can really hurt themselves, like you mentioned, the shoulder, the elbow, the knees.
Yeah, we're getting close to, you know, baseball season in our youth athletes, and that's kind of a sport that's coming up. And you know, we see these kids start throwing as pitchers and throwing fastballs and curveballs from age 12, 13, 14, 15. And one of the most important ligaments on the inside of the elbow is called the ulnar collateral ligament, which is the Tommy John ligament. And that's a big injury that we see in our pitchers. And again, it's one of those ligaments that doesn't heal. It has to be reconstructed.
And so there's a procedure though to help with that. And why is it called Tommy John? Is it after someone?
That's interesting. So Tommy John was a famous pitcher. Where I trained at Curl and Jobe Clinic in Los Angeles, the Dr. Jobe was the originator of Tommy John reconstruction. Tommy John came to Dr. Jobe and said, "I hurt my elbow." Dr. Jobe said, "You blew your elbow out, you know, your career's over."
Ugh.
So Tommy John actually said to Dr. Jobe, "Why can't you take a tendon from somewhere else and make me a new ligament?" And that's why Dr. Jobe named it Tommy John and not the Jobe procedure. And
we're looking at some video now. Can you walk us through a little bit about what we are looking at?
This basically is taking the graft from the pitcher's own forearm, and then we're getting down towards the inner part of the elbow, and we basically drill some tunnels in the bone to basically reconstruct or make a new ligament. And that ligament is basically that's the ulnar collateral ligament right there, and that basically stabilizes the ligament when a pitcher goes and brings their arm into external rotation and tries to throw. If they don't have that ligament, the elbow's unstable. So they need this. It's a very tiny ligament. It's amazing how important that ligament is to a thrower.
Can you get somebody back to 100% after this?
Yeah, that's the goal. You know, a lot of pitchers, even in the major leagues, I think the recent study said 25% of major league starting pitchers have had a Tommy John reconstruction, which
Really?
is an unbelievable stat.
And is this what you have in your office where you walk them through a little bit and show them what the expectation is?
This is a knee, so this is when we're talking about
that's a knee.
we're talking about ACL reconstructions, and the ACL is another one of those ligaments that unfortunately doesn't have the propensity to heal. So the ACL basically connects the thigh bone here with the shin bone, and it prevents the two bones from moving abnormally on one another. So when you tear that ligament, unfortunately, you have to reconstruct it. So we use a patient's own what's called bone patellar tendon bone, which is an autograft. A lot of people will use cadaver tissue, and the studies show that in young patients, if you use cadaver tissue, the failure rate is extremely high. So in all our high school, collegiate, and professional athletes, we use their own tissue. And we basically bring that bone patellar tendon bone through the tunnels
And you reconstruct it
and
that
reconstruct it, and then fix it with these, which is a bioabsorbable screw that basically goes away with time, and the body basically grows bone into it. So.
Well, thank you so much, Dr. Kaplan, for walking us through that. So interesting stuff, and good luck with the Jags. Keep them healthy and on the field for us. And we'd like to thank the Jacksonville Orthopedic Institute for sponsoring this segment. For more information, visit joi.net or call JOI 2000.